Hi, and welcome to the Canadian Common CV, or CCV, for Patient, Family, and Community Research Partners webinar. I would like to start off by acknowledging the Alberta AbSPORU Support Unit Patient Engagement Platform for supporting this work. And I would like to acknowledge our team of patient research partners who helped to co-design this webinar and workshop series. So myself, Sandra Zielinski, Vittorio Borelli, Colin Penman, Jackie Essler, Brian Dompe, who's joined with me here today, Patricia Salentino, Esha Ray Chowdhury, Peter Oxland, and our colleague from the Patient Engagement Platform team, Ingrid Nielsen. Today's webinar is to provide information on upcoming CCV workshops that we will be providing for patient, family, and community research partners. I would like to start off with 3 objectives for today's webinar and the workshop series as well. And those 3 objectives are to provide an overview of the Canadian Institute for Health Research, so CIHR, grant application process to patient, family, and community research partners, to build capacity and offer guidance for patients, families, and community research partners to apply for a CIHR PIN number and fill out a Canadian Common CV, and to establish a CCV format that highlights both the lived experiences and research experiences of patient, family, and community research partners. So what is the Canadian Common CV, or CCV? It is a web-based application required by a network of federal, provincial, and not-for-profit research funding organizations, or a tri-council agency, provides researchers with a single common approach to gathering and evaluating CV information, so during the grant application or review process. And who's CIHR? So the Canadian Institute for Health Research, or CIHR, is Canada's national or federal funding agency for health research. CIHR is composed of 13 institutes collaborating with partners and researchers to support the discoveries and innovations that improve our health and strengthen our healthcare systems. So about 10 years ago, CIHR, or the Canadian Institute for Health Research, started an initiative called the Strategy for Patient-Oriented Research. And really what that's all about is the idea that patients bring the perspective as experts from their own unique lived experiences and knowledge gained through living with a condition or illness, as well as their experiences with treatments and the healthcare system. Involvement of patients in research increases its quality, and as healthcare providers utilize research evidence in their practice, it increases the quality of care. And so CIHR AbSPORU really advocates that patients must be involved as much and as meaningfully as possible in order for health research to be more responsive to the needs of Canadians. And who is a patient, family, or community research partner? Well, it's many of us. So it can be somebody that has current or former experience as a person living with whatever health condition or disease, or that has had to access the healthcare system. It could be their family members and or caregivers that have helped them navigate the healthcare system, as well as manage their chronic disease or condition. It could be patient support groups, it could be patient organizations, community groups, or really members of the public at large. So for example, in some research projects, they might be studying prevention and promotion of health. And so then we would reach out to the public to sort of understand what might help improve or get you to live a healthier lifestyle and sort of those promotion and prevention aspects. So at the beginning of this work, with all the patient research partners co-designing this, we reached out to the patient research partner community to elicit feedback of what their experiences had been like filling out the CCV. So we really asked people who had already gone through this process, what was this like for you? And these were some of the comments that we received from some of the patient partners that tried to navigate the Canadian Common CV web-based application. So they said, it's time consuming and tedious. It's not patient partner friendly. This is not something to be done under pressure at the last minute. They, the researchers, would help, yet even each of them had different knowledge about the CCV system and seemed to expect me to already know how to do this. I think the intent and purpose of patient-citizen engagement is not being valued in the way that CIHR intends. Last-minute requests from researchers, feeling of being used, and sometimes went through all of the effort and never heard back from anyone. And lastly, I started filling it out, but lost interest halfway through, so kind of whipped through. So many categories didn't apply to me, and for some, I had trouble adding more than one entry. And so I'm going to pass the baton over to Brian, and he's going to take over the next few slides for us.
Thank you, Sandra. So this whole process was a learning experience for myself. I had never heard of the Canadian Commons CV prior to this particular workshop, so it was very interesting. I learned that there's 8 sections to the Canadian Commons CV. You can see them listed here: personal information, user profile, education, recognitions, employment, research, funding history, activities, contributions. Sounds relatively straightforward. Unfortunately, each of those 8 sections has multiple subsections, and it gets complex very quickly. And I can definitely relate to the comments on the last slide that Sandra showed. So if you want to bring the next slide up, Sandra, this is what I felt like in my first attempt at doing a CCV. Oh my gosh, what do you do if you don't fit into any of those boxes? And at this point, I felt totally embarrassed that they had asked me to work in this project. And after having looked at CCV, I didn't have a master's degree or a PhD, no credentials and knowledge translation. I didn't even know what that meant. International collaborations, like, oh my gosh, this is embarrassing. They've asked me, and I don't fit into this type of a project. I don't fit into patient partner research. Fortunately, I stayed with the project, and we were able to work through. And I ended up getting a Canadian Commons CV that I felt good about, and that reflected that I can make some contributions, and I do have something to bring forward from my lived experience. And it took a little bit of translation, so we had to translate into plain language. What is it really that they were looking for, and what is it that I've experienced and lived through and learned from that lived experience that I can bring forward? And just looking at things through that lens of lived experience makes a huge difference. So I'll move on to the next slide, Sandra. First thing we did as part of the project was condense those 8 sections down into 5. These are what we feel are the 5 key or essential sections, and the ones that reflect mostly the value that a patient partner brings to a project. And you can fill in all 8 of the sections, you can fill in all of the subsections, but these are the ones that are going to maximize and reflect best upon your contributions to the research project. So personal information, user profile, education, employment, and contributions. And during the workshop, we'll talk about each of those translations that we talked about. Under education, there's an opportunity for equivalence to degrees. And what the heck is an equivalent to a master's degree? And we'll talk about each and every one of those and how we can bring forward your lived experience and how it fits into each of those. Your employment may have been voluntary, totally voluntary employment, not related to research, but we'll work through all that. So there's some prerequisites going into the workshop. Thank you. So a couple of prerequisites: you have to have a ResearchNet account, you have to have a CIHR PIN number, and you have to have completed an equity and diversity account. So first step we're going to ask people to do is go over to the ResearchNet account, which was a surprise to me. I just logically assumed you would go to CIHR if you're looking to fill out a PIN number, but first you have to go to ResearchNet account, open up a ResearchNet account. And you can see there on the side of the slide there, email pass, set up a password, so forth. Click in and it'll bring up some questions in the next slide, Sandra. Pretty straightforward: language, email, salutations, first name, middle name, so forth, password, secret word, everything along that line. So we'll fill out all that information. And next slide, Sandra. We'll get a thank you very much confirmation. We received your application, and we will get back to you, check for a confirmation email with your confirmation of your ResearchNet account. Once you get that, then we're going to go back into ResearchNet account, log into our ResearchNet account. Over on the right-hand side, you'll see the drop-down where it says register for CIHR PIN number. That's the next step in the process. And it'll bring up the following questions. So some of this will already be populated from your ResearchNet account application, language, first name, so forth. You can look and see the information there. It's all pretty straightforward. Maybe the most confusing is alias first name. And just as an example there, my father's name is Batista, but here in Canada, his alias is Bob. He goes by Bob ever since he went to school. So we're going to complete all that. Next slide, Sandra. We'll hit submit. And we're going to get, thank you very much. Your request has been accepted. We're on our way. But if you read the fine print down there, oh, it says here, we only process during business hours, 8 o'clock to 4:30, regular business days, Monday to Friday. So, you know, Sandra had talked about in that one slide, there's a comment about the last minute, it's under pressure. You don't want to be doing this in the last couple of days before the grant application is required, because if you're filling this out on a Thursday or Friday before a long weekend, it could be several days before you actually get your PIN number. So next slide, Sandra. Just quick summary, 6 steps there. This is what we talked about to get your PIN number. First, go to ResearchNet account, set up your ResearchNet, submit that, get your confirmation, go back in, register for your PIN number, and wait for your confirmation in regular business hours, regular business days. Next step, one more step to go. Equity and diversity questionnaire. So we have our ResearchNet account, we've got our CIHR PIN number. You have to have equity and diversity questionnaire completed before you can move on to doing your CCV. Short questionnaire, it says here it takes 5 to 10 minutes. I doubt that it would even take you that long. There's 5 simple questions, just demographics in general. We want to make sure when we're doing research that that it's representative of the population across the country. And in some cases, the research may target a certain specific segment of the population. So the questions are, you know, what's your age? What's your sex? Do you have an Indigenous background? Are you a visible minority? And do you have a disability? Just so that, again, they make sure they have the right people working on that project that's going to reflect the right segment of the population. And Sandra, if you want to tell them those are the prerequisites, if you want to move on and tell them about the workshop.
Yeah, great. Thanks so much, Brian. So we'll just go into a little bit of the content that we'll be covering in the CCV workshop. So once you've filled out all those prerequisites that Brian talked about, and now it's time to come to the workshop, we will start off by going through some background information on grant application process. We will talk about grant roles for patient research partners in the grant application. We have a table that we put together with the various roles, responsibilities, as well as the requirements that patient partners will have to fill out in order to be a part of that role. So that could be, for example, they might have to provide a letter of support. We have some templates and examples that we've put together, as well as some tips on how to write letters of support. They may have to fill out the most significant contribution section. So we go through that and the type of information that needs to be included in that most significant contribution section. We touch a little bit on research ethics. We also provide, so once a patient research partner or a research network has registered for the workshop, we will provide some pre-workshop homework along with all the details that Brian just went over, so that the participants can get all of those items done in advance and then be ready for when we come together at the workshop. And then we will actually work together, and each individual participant that has joined the workshop will start completing and filling out their CCV. We will provide some CCV tips. We will show everyone how to generate a biosketch number. We will talk about some special considerations and some supports that are available for patient research partners post-workshop, should they need some extra help later on. So if you have any questions or would like to register for an upcoming workshop, so if you're a patient research partner or you're a researcher that's partnering with patient research partners and would like your patient partners to be a part of that grant application process, and so therefore taking the CCV workshop, please contact the Alberta SPORU Support Unit Patient Engagement Platform at our email address, peplatformab@gmail.com, or you can visit our website, and there's a link here, but we also have on our next slide our 2 websites where you can also find more information about what we do as the Alberta SPORU Support Unit Patient Engagement Platform. So we have www.absporu.ca, and you'll find the patient engagement link in that website. And we also have www.albertansforhealthresearch.ca. And on that website, you'll find we have a whole bunch of resources about patient engagement in research. So we have an ethical considerations document, how-to resources. We also have opportunities that are up there. So if you're a patient research partner looking to partner in research, some researchers have posted opportunities to get involved in research. And we have some of our social media activities, et cetera, on both of those websites. So please feel free to reach out to us at the Alberta SPORU Support Unit Patient Engagement Platform if you want to learn more about the CCV workshop and how to register. And lastly, we would like to acknowledge our funders. So University of Calgary and the University of Alberta, the Alberta SPORU Support Unit, CIHR, and Alberta Innovate. And I'd like to thank you for your time today. Thank you very much.